am a first-time mom, and my baby was born in October of 2025. So that physical healing process was really, really challenging. And I think that for me was the hardest part, because I knew it would be bad, but I didn't know it would be that bad.
Welcoming a new baby is a special time, and Family Connects helps families start with confidence through free in-home nurse visits, trusted guidance, and connections to local support. Family Connects is an amazing program that will both improve maternal health, newborn health, as well as reduce costs. In this video, you'll hear firsthand how this program strengthens families and saves lives in our community.
So just having Jasmine, my nurse from Family Connects, come into my home and sit with me for a couple hours, work with the baby, make sure everything's going well, and to really check on your mental health as well is so important.
When we look at our maternal deaths, the majority of deaths are not happening in delivery. They're happening after delivery up to 1 year postpartum, with the majority of those happening in the first 6 weeks.
At least 14 days postpartum, you will get to see an in-home visiting nurse.
When we look at postpartum deaths, we really see that there are some that are sort of clinically related, so postpartum hypertension and hemorrhage, and then we see some that are more socially driven, like substance use disorder, intimate partner violence, homicide. And so we are really, with that nurse visit, trying to address both of those buckets of risk factors.
I would say if I have 8 visits in 1 week, 4 moms will have maternal depression. We can see hypertension right after pregnancy, where we have postpartum hypertension. And you start to have symptoms like headache, shortness of breath, blurred vision, right upper quadrant pain. And most people, if you think about those symptoms, were associated with fatigue. Oh, I'm tired, I'm sleepy, the baby is keeping me up at night, not knowing that they have a blood pressure where the systolic is over 160, not knowing that that can cause that patient to have a stroke. And that's the reason I get up each and every day, because of the impact that I make in all of my family's lives, no matter if it's medical or just emotional support.
Most of the research on this program has come out of its initial implementation in North Carolina. And so some of that data showed exactly what we're seeing in New Orleans. It showed improvements in maternal and infant health outcomes. It showed reductions in emergency and inpatient hospitalization. Is mom having to go to the emergency room because she doesn't know if she's healing well from her delivery? We can reduce those costs an average of $1,500 per family served, compared to families who don't participate in Family Connects.
As healthcare providers across Louisiana work to improve maternal health and support newborns, I want to first thank everyone who helped pilot Family Connects in the New Orleans area. I'm proud to see positive results from this effort, and I will keep working to help more families across Louisiana get the support they need.